Welcome back. Well, our next guest says stop the fad dieting and stop starving yourself if you want to lose weight. Abby Baneck is a nurse practitioner with Advanced Medical Weight Loss Centers of Wisconsin, and they have a program that can be specifically tailored to your body. Welcome to the Morning Blend.
Thank you.
Thanks for being here. I think this is great. Abby, you're a nurse practitioner.
Yes.
We were chatting during the break a little bit. You used to work at Children's Hospital.
Yes, I did.
And now you work for the Advanced Weight Loss Center of Wisconsin.
Yes.
What's the difference, you know, when someone's looking at dieting from a nursing perspective, what's the difference between like a fad diet and traditional diets and what you're doing there at the center?
So what we're doing is basically it's a medical weight loss center. So you're followed by medical professionals that are trained in weight loss. So essentially we monitor you from day one to even after you reach your weight loss goal, which is amazing because these people are essentially getting wonderful, wonderful results with us, and it's a diet that has been studied over and over again, so it works.
Well, and I think it's great that you look at the person and you say, hey, this is what hasn't worked for you in the past. How can we tailor this to your specific needs, right? You look
Absolutely.
at the person.
We do. You know, when they come in, they come in, they sit down with us, we talk about their past medical history, and then take that and do a complete physical. We do EKG, we do labs. We really look into their overall health. And then once we finalize what their overall health is, then we find a diet that essentially works with them. And they ultimately get great results.
And what kind of results are you seeing? Are you seeing people lose 10 pounds, 20 pounds, 30 pounds?
Generally, it depends what diet we place them on, depending on their overall health status. One of our diets, they generally lose a pound a day. Another one of our diets, you lose 2 to 3 pounds a week.
That's great. And a lot of people know that healthy, you know, weight loss can be the 2 pounds, but medically supervised weight loss can be a little bit more. What do you think makes you guys different in general? Is it that you have high quality staff like yourself who are nurses?
Absolutely. We take obesity very seriously at our facility, only because we know obesity can cause a multitude of problems, including type 2 diabetes, heart-related conditions, aches and pains in your joints. So we take it overall very seriously. And then once again, like I said, you are medically supervised. So if they have any questions about their overall health, they can call us anytime and ask us, and we can sit down and teach them about, you know, the difference between eating the way they were and eating the way they are now, and teach them to honestly have a really good base on eating.
Just that knowledge, you know, we hear so many guests that come on the show that have changed their diet. They've lost weight over the years, or they've removed or added certain kinds of foods, and just how different they feel.
Yes.
You know, a lot of people describe it as like a fog being lifted off, you know, their sight or their vision or the way they feel so much better.
Yes.
What specifically will people experience? What does your program or your programs entail?
So we have the 2 different diet programs. One of them is more of a radical approach. Like I said, that one you lose 1 pound approximately a day. That one includes HCG. And then we have one that's more conservative approach. That includes other medications that, and like I said, it's medically supervised, that will help the patient ultimately lose the 2 to 3 pounds a week that and find the results that they would like to.
And how do people feel? You know, because sometimes when you go on a diet, you get headaches, you're hungry, you're tired.
Many of our patients don't come in with complaints at all during their weight loss program. If they do, like I said, we're there to assist them in any way, but they feel wonderful because they're losing weight. They're taking that weight off their joints, and they're feeling and looking great. So they come to us with a smile on their face, and they're excited. So.
That's great. Well, and speaking of people being excited, Lisa is one of your clients who's had some great success. Tell us a little bit about her. She looks amazing in this before and after.
So this is Lisa. This is one of many of our success stories at our clinic. She lost 30 pounds in 30 days using one of our more radical approaches, and she looks great, and she's, like I said, one of our many, I know.
She looks like they could be sisters, not the same person.
I know. She comes in, and as far as follow-up, she comes in once a month, and we just talk about, you know, how to maintain her weight, and she's done excellent.
Well, I think it's wonderful. Not only do you have these great people who, I love the fact that she was just willing to share that great photo. She's got to feel wonderful. But that you follow up with people afterward. You really maintain and help them maintain their weight loss and their goals. I want to make sure everybody knows about a special that you're offering at Advanced Medical Weight Loss Center of Wisconsin. There's a morning blend special right now where you can receive 20% off their program if you mention that you saw them here on the morning blend. Just say, hey, Abby was great. I want to know more. Here's where you can find Advanced Medical Weight Loss Centers of Wisconsin. They're advancedmedweightloss.com for their website, or call to make an appointment in Oconomowoc at 262-200-0700. They're located right on Pabst 2700. Sorry, I wrote that down wrong. 2700 for the last numbers. They're located right on Pabst Farms Circle in Oconomowoc. Thanks, Abby, so much.
Thank you for having me.
Appreciate it.
Thanks.